If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. This is our 10th season, and we are here to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to become an informed patient, and we are here to bring you timely health discussions. Remember, though, always consult with your primary care physician because each person's health deserves special attention. But for those who are new to the show, there are two ways to get your questions in. One is by calling our live phone line, and the other is by visiting our website at netny.net/askthedoctor. Here you can submit questions and opinions via the forum. For this episode, we have Dr. Sagarika Nalu, Pediatric Neurology, Epilepsy, and Adult Sleep Medicine Specialist at New York Methodist Hospital. Then next to her is Dr. John Heitner, Director of Non-Invasive Imaging at New York Methodist Hospital. And then we have Dr. Anthony Saylor, a pulmonary attending at New York Methodist Hospital, as well as a member of the Board of Trustees. Thank you and welcome. So, boy, that's some introduction. I mean, we got titles here and work, but I know it's an exciting show. I get the feeling it's going to be one of our best shows. We have recurring guests, Dr. Saylor, who's been many times with us, Dr. Heitner, and Dr. Nalu, who's first time.
First time.
But we're going to find out about you as we go on, so we'll see. Now, what I have is I always like to bring in a little something to make it a little higher profile of the show. And today I brought in what we call a functional MRI. And very interesting story this past week. You remember like the Terry Schiavo case, in case where people are in a vegetative state and we thought they can't talk to us. They don't know what we're saying. And lo and behold, somebody noticed that on a functional MRI, which shows us more than just the structure. So for example, here's a brain and we can see if the brain is dead or has scarring and so on. But the test on the X-ray view box shows us blood flow to areas and metabolism that cells are living. And when you ask people to think of imagery, to think of a beautiful field or something, a certain area of the brain lights up. When you ask them to think of playing tennis, another part of the brain lights up. Now you could tell the person, every time you think it's a correct answer, you want to say yes, think of tennis. And if that happens, then a certain part of the brain is going to turn red. And this is what we're going to find. And then we could also say to them, when you want to say no, think of a beautiful field, and that would be the green area. So they decided, let's ask and see if they can get the test right. So they made up 50 questions, yes and no. And believe it or not, a guy got 100% right who's been in a coma for 5 years, who was felt to have no brain function at all. Well, this changes the way we're going to have to think about these patients, the way we treat them, the way we talk to them, and they actually do understand. Now, we don't know the extent of it. We know that this is a small study, but it's an amazing study, and using this functional MRI, so it's an MRI that shows function, we can actually talk to patients. So it's something that's going to open up a whole new thing, and I thought it would be interesting to bring here. So let me put this away for now. The other test, the other new thing in the news, has to do with vitamins. It seems that multivitamins have taken off more than half the American public is taking a multivitamin, and when you ask them, they don't know why. Just, let me make sure I'm getting what I need, get a little extra energy. And these are all nonsense. It doesn't give you any extra energy. And more than 80% of people are getting correct number of vitamins from their diet. Now, if you do need vitamins, for example, vitamin D for a woman who's postmenopausal or who has bone weakness, makes sense. Or a pregnant woman needs folic acid. But what doesn't make sense is to just indiscriminately take multivitamins thinking, oh, they're not going to hurt me. Because we've had a number of overdose cases now, even in children who have taken too much vitamin A from eating chicken liver every day and taking multivitamin every day. Vitamin C, we can get problems with stones and so on. So the key is, you don't want to take something just and say, I'm going to take a thing that doesn't work, because it's not totally innocuous. You want to ask your doctor, get a profile of your blood, of how your health is, and if you do need vitamins, take the right ones. Take the ones you need, but don't just keep popping a pill, because it's not regulated by the FDA, so you get it over the counter. They even make it like candy, right? Flintstones and stuff like that. So something to think about. And last in the news, case of the blues or grays. And they took about 1,000 people, and they studied how colors reflected their mood. So they asked these people, what's your favorite color? So what do you think 1,000 people said was the favorite color?
Black.
Blue.
Blue.
Blue. Absolutely. Blue is the favorite color of 1,000 people. Then they took people who are depressed, and they said, what color do you associate with your mood? And they came up with gray. But people who are happy, what color do they like? Take a guess, because I think there's a happy panel here.
Yellow.
Yellow. See, I told you she was happy. She's going to start smiling a lot as the show goes. Very happy person. And the yellow, so now what good is it? Well, let's say somebody can't communicate. It's a child or somebody who doesn't speak well, doesn't speak English. By understanding the colors and the way that person is feeling, you can get a better insight into depression or the mood of the patient. So I thought it was an interesting study. We like to bring you here stuff that's interesting.
Surprised you didn't wear a yellow suit.
Yellow suit. I got maroon, but you don't know how I'm feeling. So, okay. Now, this is the all-important, I know everybody's been waiting for this quiz that Linda Lapatosa, the quizmaster, has come up with a tough one this week. What word in the English language, I don't know why she says English language, not like Spanish. What word in the English language has 3 sets of recurring double letters, and they're in a row? So the word in it has, like, let's say the letter EE, then followed by WW, then, so in a row has consecutive sets of three sets of recurring double letters. It's a tough one, right? Tough one. I open it up here. We can all shoot for that. And also, before we go to a short break, I have to mention 2 people. Anthony Falacaro and Pankaj Patel work at Bay Ridge Lexus Service Department, because I want to get my car back tomorrow. But anyway, they're very big fans of the show, and I always like to mention people who are big fans. And Anthony likes to eat at Fiorentino's. You know where that is? It's in, I think, Avenue. Is it Bensonhurst? And Pankaj Patel likes to eat at Pacelli's in Staten Island, which I've heard a lot of good things about. I don't know, have you guys been there? Supposed to be music on a Saturday night and a lot of very good for romance, so something to think about. So what we're going to do is, I see we got the phones lit up. We're going to take a short break, and when we come back, we're going to go right to the phones. Now, this is the key number. The phone number is 718-499-6101. Here you can talk about pediatric neurology, such as autism, febrile seizures, adult sleep medicine. We'll also cover non-invasive imaging for your heart, MRIs, and of course all the lung problems, breathing problems you have. So call now, 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are pediatric neurology, adult sleep medicine, non-invasive imaging of the heart, and lung disease. The number to call is 718-499-6101. I have to mention Monsignor Bennett. He hasn't missed one show in the 10 seasons. Monsignor, thanks for coming out. I know a big snowstorm tomorrow, and maybe we'll talk to Dr. Heitner about some of the things to avoid. I know the schools have been closed, so if you're watching this in a rerun, remember it took place April. I don't want the kids to tell the parents no school tomorrow. So, okay. So, Dr. Nalu.
Hi.
It's a pleasure to have you here.
Thank you.
You got a lot of areas you're covering, pediatrics, a little adult sleep lab. Tell us how you got interested in something about your training. How did you get to this point?
Well, primarily my training was in pediatrics. I did a pediatric residency, and at that point I was interested in neurology. So I did a whole fellowship of pediatric neurology, which is actually 3 years, 1 year of adult medicine and 2 years of pediatric neurology.
So how many years of this training?
So that was 6, and plus I did a whole year of epilepsy, which is whole training about seizures, and then a whole year of sleep medicine.
And your husband's probably happy you're out making some money now, right? No.
Well, he's doing a lot of training himself too.
Okay, so it was good for the goose, right?
Yeah.
But that's great. And I understand you got a little romance plan for next month, a little trip to Paris?
Yes, we are taking a trip to Paris,
wow.
and we'll be doing a lot of traveling.
Have you been there?
No, this is our first time.
You take a little boat ride on the Seine and
hopefully,
look
hopefully.
out. Okay. Dr. Heitner, it's great to have you back.
Great to be back. Thanks, Steve.
And I know you're doing wonders over at the hospital, the non-invasive lab. I think it's the only one in Brooklyn, or the best one in Brooklyn, I'm going to say 100%. I had the opportunity to use it, and I was amazed at what goes on there. Tell a little bit about what MRI of the heart can do, because many don't know.
So MRI has really opened up the entirely new imaging of the heart. We've seen new things that we've never seen before, such as looking at the heart muscle that have had a heart attack. You can see exactly how much of a heart attack there is. Looking at the big vessels like the aorta, just phenomenal imaging. Really, we're just thrilled about having it at Methodist.
Amazing. So if let's say you get chest pain, right? Where would that fit in? Would I go to you? Would I go to a stress test? What would I do first if you get chest pain?
So interesting, yeah, we actually do stress MRI, and that is one option. It depends on kind of your demographics, how old you are, and how significant chest discomfort is. But we would usually start out with doing some type of stress test.
Interesting. So we're going to get a lot of questions, I know, tonight, so be prepared. Take a rest while I speak to Dr. Saylor. And Dr. Saylor, it's a pleasure to have you back. I love when you come on the show. And I always comment about your position on the Board of Trustees, which is a very important hospital. Just very unusual to have a doctor on the board. Tell a little bit about what goes on there in those meetings.
Well, it's really much ado about nothing. It's an administrative position. The board members work sort of in concert with the administration. And to have, I think, as a board member, to have someone like you and the panel this evening, that's what makes it a great hospital. Great doctors who know their craft well. So I'm very proud to be here. Thanks
One
for
of the
having
best pulmonologists, but more importantly, one of the best Yankee fans in the whole city. What do you think about the Yanks' chances coming up?
I'm looking for a repeat in 2010.
Looking for a repeat?
Yes.
And what about Johnny Damon? You think he's pretty much
A
going
little upset by Damon's loss, but hopefully Granderson will have a big year.
So who's your favorite Yankee?
Mariano.
Mariano. And his number?
Retired forever.
Very good, very good. And the Met fans?
Good luck.
We wish you good luck. So, but anyway, let's go right to this busy phone. We don't know. It could be Maddie. Could it be Joel? Let's going to see who's on line one. Hello, who's this?
Hello?
Yeah, who's this?
This is Maddie.
Maddie, how are you? You beat Joel out again. Your first caller again.
Okay.
What do you do? How are things out there tonight? You getting ready for the big snowstorm?
Yeah.
So
I don't like it, though.
What do you do with the snow? Did they come by? The kids come by to shovel?
No.
No. All right, Maddie, you got to turn that TV off.
Okay.
Could you turn that off?
Yeah, all right.
Thanks. Okay, now let's see what question Maddie's going to have tonight. Maddie, what's the question for tonight?
The question is, my fingers got numb and cold. I mean, I can move them, but they're cold and numb. What is it, old age? 89?
No, you're young at 89, but let's ask Dr. Nalu.
Hi, Maddie. How are you?
Okay.
So how long have you been having these symptoms for?
Quite some time, but I don't bother, I don't let it bother me because I just keep going.
Okay. Is it any particular time of the day that you have these symptoms more?
No, I just don't, I don't know. I move them and everything, but they're cold and numb, you know?
Are you on any medications?
No.
No high blood pressure, no diabetes?
No, none of that stuff.
Okay. And when was the last time you had a routine checkup, your blood work?
Some time ago, I think I had blood work.
Yeah, I think it was recent because
No,
we had
when
another.
I went to that doctor, in Avenue J.
All right, did you go to Dr. Kutsina?
Yeah, I had the blood taken there.
But the question is, you think this could be related to her neck, or could this be related to what else? Because in the mornings, I remember that it's bothering her, and the cold water makes it worse. So.
Okay, it could be related to her, nerve injury or any nerve compression. It could be as simple as carpal tunnels, although she has bilateral numbness as she's experiencing. It could be a neck radiculopathy or herniated disc.
So Maddie,
we have to do more tests to know what it is.
It's bothering her a long time because this is a frequent question. Mm-hmm. So so you think that she should go for maybe some X-rays?
Yes, definitely X-rays of the neck would be the way to start, and also people who have a lot of arthritis also have these similar complaints.
So Maddie, anybody else? Any other thoughts, by the way, from our? So Maddie, we're going to try and get you some X-rays. Maybe give me a call tomorrow, and we'll try and set you up for some X-rays. Okay?
Yeah. Okay.
I hope you have a great week. Take it easy with the snowstorm.
Thank you. Thank you.
Good to hear from you. Maddie's one of our favorite caller. We're going now to Neil. Hi, Neil.
Hi there.
Where are you calling us from, Neil?
Ridgewood.
Ridgewood. Where's Ridgewood? I know exactly. Is that on the border of Brooklyn, Queens?
Brooklyn and Queens, yeah.
Yeah.
Okay.
So,
I called you last week. You suggested I call you back.
You live in Williamsburg?
Yes.
Right. So just give us a brief synopsis. I know you had a number of issues, and then let's try and get to it.
Okay. For the past 11, 12 years at night, I have to get up every night, every couple of hours. I have gas and burning in my stomach. Now, I've had endless endoscopies and colonoscopies. I went through the medicines that they thought was acid reflux, which I don't have. They try to treat it that way, and nobody seems to know what my problem is.
All right, let's hold there, Dr. Sala. Said there's burning for a number of years, so that's one good sign that's going on for a while.
Right.
But it's not reflux, and what he's at wit's end.
And it's only at night.
Are you on any medications?
No, I just take Plavix because I had a stent.
Right. So, Dr. Heitner, how do you feel about?
I don't think Plavix is a
No. I'm
unlikely to cause that. Do you have diabetes by any chance?
No.
No. Okay.
Doctor, if he has problems with the arteries of the heart, could he maybe have artery problems in the stomach?
Well, I didn't have that. Oh, I had this is going on for the last 11, 12 years, so I had no problems with my arteries then.
Right, but typically when you have arteries, sometimes when you have arteries that are trouble with the heart, you can have the same problem going to the stomach and the gut. But that usually presents after you eat. You'll have pain and stuff.
Oh, no, I don't have that. It's just strictly at night. I go to bed, and 2 or 3 hours later, I have to get up with burning and gas. I relieve myself with the gas. I go back 2 hours later, same scenario. Now, during the day, nothing. I'm fine.
Does it happen when you sit up? Because maybe if you sat up straight, that might help. That would be.
I have my bed elevated, and I have 3 pillows.
And that doesn't help.
And that doesn't help.
Are you eating right before you go to bed?
No. What happens, like in the summer, I eat very good. I eat fruits and salads, and it still does the same thing. And I don't eat before I go to bed.
Or you know, it's a tricky case. It sounds like it happens before you go to bed. Are you diabetic?
No.
Right.
Maybe a pH monitoring. It sounds like you need a little more extensive testing.
Well, I've had, like I said, I've been through about 4 or 5 gastroenterologists, and nobody seems to have the answer. So I figured I'd give it a shot. I'd call you up.
Neil, I want you to call me after the show. I'm going to recommend a gastroenterologist. I think he'd give it a fresh opinion. Maybe help you out, okay?
Okay.
Thanks for calling back, and we'll hear from you next week, I hope.
All right. Well, you want me to call you after the show?
Yeah, call after the show.
Okay.
Take care. Hi, Joel.
Oh, hi, Dr. Garner.
Joel,
how are you?
Great to hear from you. How are things in Massapequa tonight?
Things are good. I'm expecting a big storm out here in Long Island.
Yeah, I don't know. They closed the schools already. Is that? You think they're panicking a little bit? You think?
Yeah, it's going to be nothing. It's always nothing.
I'm getting that feeling. Yeah. Maddie's fingers. I forgot they could tell the weather. Maybe I don't know.
They blow it all out of proportion usually.
So what can we do for you tonight?
I have a question for Dr. Nalu.
Oh, we're putting it to work. So, yeah, there's a lot of work.
So I have somebody I work with. They just had a baby, and like 2 or 3 weeks ago, and they said the baby's got Erb's palsy, and she's a little worried. You know, what does that mean? Does it get better? What do you do for it?
Well, the Erb's palsy is very, it depends upon the severity of the Erb's palsy and what are the complications that the baby had during delivery, and how severe is it right now, and is it both sides or is just one arm? So most of the time the treatment for Erb's palsy is physical therapy. You prevent the arm from having contractures, so you give the arm the physical therapy, and you rest the arm initial stages. So we have to follow to see what kind of therapy is recommended for the baby. Usually we have to see the baby initially and then follow very closely to see the improvement. Most of them, they improve just with the therapy, meaning the physical therapy. And a very small percentage of them, they have to get surgery done to repair the nerve.
It's a little scary because these deliveries, sometimes they're a little rough delivery and you come up with this palsy. And it's interesting. C-section is definitely more dangerous procedure, but there's not that obvious. You don't get Erb's palsy with those, right? With the C-sections.
Not necessarily. You can still get Erb's palsy depending on the baby's weight and what went on, and how long the labor was prolonged for, and all of that things.
So Joel, we hope that answers the question.
It does. Thanks a lot.
Okay, take care. Have a nice week.
Okay.
Take care. We now have Grace. Grace, hi. How are you?
Yes, hi. I'm from East Flatbush.
East Flatbush. I hear the accent. I picked it up right off the bat. Now, I understand there's a rumor that you may have the answer to the question.
Yeah, Mr.
Okay, hold on. We have a drum roll for that. Drum roll.
Oh, I'm sorry.
Okay, Grace. Grace, what do you think the answer is?
Bookkeeping. Is the answer bookkeeping?
Bookkeeping? Yes.
That would do it.
You got it. You got it. How did you? What made you get that?
Well, it just came to me.
Excellent, excellent, excellent. Is this the first time you're playing the quiz?
Yes.
Wow. We got to get this plaque
I
right.
have no computer. We're in our 70s. My husband doesn't want to get me a computer.
And so there was no cheating here.
No cheating.
This is great. I'm really glad you won
impressive.
it. Grace, have you given any thought to where you're going to put this plaque that's going to be heading out to you?
In my living room.
Excellent, excellent. So, imported, handmade from Japan. It's amazing. And it's going to be sent out right away, freight mail. We try and save a little bit on the show, but can you wait? You should get it by Monday.
Good, good. I appreciate that. And also, I want to add, I had called a couple weeks ago about my osteoarthritis. My husband made a date with the with my orthopedic surgeon March 5th. So I'll let you know how I made out.
Great, great. And we're so happy you won.
Downstate Hospital.
Downstate, excellent. I think Dr. Nalu trained at Downstate.
Yes, yes.
And my daughter Eve is a radiology resident at Downstate. Did any of you guys train at Downstate? That's a very good hospital. So Grace, she's all excited.
Yes, Dr. Urban. Dr. Urban.
Excellent, excellent. So Grace, I'm really happy you won this, and you won it fair and square.
Thank you.
Okay?
Okay, I'm very happy.
Okay.
At least I got something.
Yeah, you're going to enjoy this. Stay on the air so we can give you the...
I like to listen to you people. You're excellent.
Oh, thank you so much. Thank you. Okay, Grace, we'll see you next time. Hi, Robert.
Hey there.
Hi, Robert. Where are you calling us from?
Where am I calling from?
Yes.
I'm in Brooklyn, Canarsie, actually.
Oh, I used to love Canarsie there. My kids went to school in Canarsie, PS 276 and Bildersea. You ever eat out there on the pier at Bracciamento's? Robert.
Yeah, say it again?
I'm sorry to interrupt you.
Yeah, a while back.
Yeah, remember at Bracciamento's?
Actually, my friend sold Christmas trees on the corner of Bell Parkway.
Ah, yeah. Could you turn the TV down?
Yeah.
I was watching
Okay.
American Idol, so I got to... Okay. So, Robert,
Yeah.
what can we do for you tonight?
My mom's got an issue with her right ankle.
Okay, what's the story?
And it started to swell up in November. She's right next to me, actually.
Okay.
It's very swollen. It's stiff, and it hurts. She can't walk on it. She took 2 X-rays. It showed tendonitis, but the foot specialist said maybe she should take an MRI. Gave her a needle in the ankle. Didn't help.
Okay, so only one side?
Just one side.
And
The other ankle bothers her a little bit. She's actually wearing on the right ankle, she's wearing a compressed stocking.
okay.
Most of the
Is
day.
she, would you look at her, would you say she was overweight or normal weight?
You're not overweight or normal. You're normal weight? Yeah, she's at normal weight.
Okay. Anybody have any thoughts on a swollen ankle one side? I mean, again, we're going to have a podiatrist on soon in the next coming weeks. But at this point, you know, tendonitis, these are very tricky to deal with, and you tend to worsen them by walking on them, which also, if you don't walk on them, it causes problems. And a lot of times, you don't find the actual cause. You treat it with medication, and hopefully it goes away. Any thoughts on any systemic, any diseases? You know, you want to make sure you're not missing something that could be in the bloodstream or something like that. Does she have any fever?
No.
And does it feel hot, the ankle, when you put your hand on it?
Does your ankle feel hot when you touch it? No, there's no burning. Does it feel hot though? I guess. No.
Yeah, it sounds like an MRI might help to show what's going on.
MRI might focus on it more.
Yeah, I think that's the way to go.
Has she tried a course of anti-inflammatories like ibuprofen for about a week?
Has she taken any Motrin?
He gave her Feldine, but she's got a sensitive stomach.
Yeah.
She does not take it. Maybe there's something else that you could take.
Yeah, you know what? They all pretty much work the same way. You know, may have some. I think let's get an MRI and see what's going on. All right? I think that's the next step. It's been going on for a long time. All right, Robert? See,
I will take an MRI and give you a call back then.
please, I thank you. Okay. Larry?
Yes.
Oh, is this Larry from Rockland County?
This is Larry from Rockland
This
County
is-
with a miserable cold, doctor. Don't get too close to the phone.
Oh, excuse me. But no, this is, I just want to tell you, Larry calls almost every week from the computer. Watches it on the computer because we don't reach Rockland County yet. We're working on that. And he actually won the quiz 2 weeks ago. Did you get the plaque yet?
Yes, I did. It's a beautiful, beautiful plaque.
It's magnificent.
Yeah, beautiful plaque.
Where'd you put it?
We have it in our dining room.
Excellent, excellent. We like that. So,
I would have a question for the MRI specialist.
Oh, Dr. Heitner, yes.
Dr. Heitner? Dr. Heitner, I've already had open heart surgery, and every time I go to the cardiologist, they either want to take an echocardiogram or they want to take a stress test, and it's all this constant exposure to radiation. Why don't they just simply use an MRI as a diagnostic tool instead of using, all of these other devices?
That's a very good question, actually. Just to lay your concerns, echocardiography, there is no radiation in that, so that's a pretty darn safe procedure. The nuclear stress testing does have radiation, and I think a cardiac MRI or stress MRI is a very nice alternative to that. We generally don't advocate routine stress testing for people after bypass, only really if you have symptomatology. But that is somewhat debatable depending on which cardiologist you ask.
How are you doing? Are you feeling okay?
Yes, except for a running nose right now. But the only time that I feel some symptoms sometimes is when I exercise after I've eaten, and I feel a discomfort. But when I exercise, without having prior dinner or lunch, I have no difficulties at all. And that was my only concern, and that's why the doctor said something about taking a stress test. But if an MRI gives you all of this information that you described when you were giving your brief introduction, it would seem to me that would be the way to go.
I think it's certainly an alternative if you're uncomfortable doing a stress test. Alternatively, you may want to stop exercising after eating and try to exercise.
Is there any problem with the metal from the bypass?
No, no problem at all.
Good. So thank you, Larry, for the call. Hope you feel better from the cold. Don't go shoveling tomorrow.
No.
Right? I mean, isn't that double? I read this. If shoveling a normal front walk is like playing an hour of singles tennis, that people don't realize, and the cold. And what do you think, John?
I actually had the experience of shoveling the driveway for the first time in about 15 years, about 2 months ago in Minnesota, and it felt like playing basketball with Dr. Sal over here.
That's a tough.
It was,
well, eventually it'll melt anyhow, so...
leave it alone, yeah.
Good luck, Larry.
Take care.
Thank you very much, Doctor.
Be well.
Take care.
Thanks. We're going to have to take a short break. We have bills to pay. But I got to ask one question to Dr. Saylor. As we approach year 10, can't believe it, of 2001, the 9/11, what people should be worrying right now? Are you seeing people coming in to say, I was in the neighborhood, I was nearby? And do you believe that the changes we're seeing are coincidental, or are they related to exposure?
Sure, that's a great question. I think that we've learned a lot in these 10 or these 8.5 years now. The problem with that day was so much of it, or there were so many fumes and dusts, and the plume that came up, that terrible smoke, that's so abnormal. That's not like being in a regular fire. That's not like just being exposed to some asbestos. That's such an abnormal exposure that we really don't know a lot about. So we know that these patients get bronchial hyperreactivity, they cough, they get an asthma-like syndrome. We know many of them have gotten sarcoidosis, interstitial lung disease, but there's a lot that we don't know about, and I'm just not sure we're ever going to know about it. So that's one of the real tragedies of that day, besides all the lives that were lost, the people who are sick and really have no answers.
So what should they're out there, they're worried, what can they do? If they're feeling a little shortness of breath, is anything they should be doing?
Well, number one, don't smoke. I mean, I think that's the most important advice we can give. And then just good lung health, exercise, and if their breathing is really short, go to their primary doctor, find out Maybe they need a cardiac workup, a pulmonary workup, but they should see their primary doctor.
Very good. So anybody, I know we have a lot of our listeners were at 9/11 and did work afterwards. But my producer said we got to move on because we got to pay the bills. So let's take a short break, and when we come back, we're going to talk about pediatric neurology, such as autism. We're going to get into febrile seizures as well, and of course adult sleep medicine, a lot of sleep apnea around, non-invasive imaging of the heart, which is really top-notch service, and of course Dr. Saylor will be talking about pulmonary problems, asthma on the rise, bronchitis, COPD. So the number is 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, where our topics are pediatric neurology, adult sleep medicine, non-invasive imaging of the heart, and lung disease. With me I have Dr. Sagarika Nalu, pediatric neurologist, epilepsy specialist, and adult sleep medicine specialist. Then I have Dr. John Heitner, the director of the cardiac non-invasive imaging at New York Methodist Hospital, and Dr. Anthony Saylor, a pulmonary attending. Now, the number to call is 718-499-6101. We're going to get right back to the phone. We're still discussing that Grace picked up Bookkeeper, which is quite impressive, Grace, and no computer at home. Excellent. So who's our first caller? Alan. Hi, Alan.
Yes.
How you doing tonight?
I'm fine, thank you.
Where are you calling us from?
I'm calling from New York.
Oh, which part of the city?
Brooklyn.
Oh, which neighborhood?
Bed-Stuy.
Bed-Stuy.
Yeah.
What's going on? No good restaurants in Bed-Stuy, huh?
They have a few West Indian restaurants.
Give us one. Like a little vegetarian and fish.
Let me see. There is the Bajan Cafe.
Bajan?
The Bajan Cafe.
Oh, okay.
And it sells a lot of West Indian food.
Okay. And where is that located? Near?
And that is located between Schenectady and, I think, Schenectady and New York Avenue.
Oh, good. We're going to try that out one time.
You must do that. And I realize that the topic tonight is mainly like cardiology and so on.
Yeah, cardiology, neurology, pulmonary, lungs. What do you have?
Well, I had talked about one of my problems, but I also have a problem where I've been to the doctor.
Yes.
And I had all different kinds of tests and so on, and yet I can still feel like every now and then my heart tends to like race, like beat a little fast, and I can feel it palpitating.
Okay, so I want you to step back, and we're going to hear Dr. Heitner is going to tell us what he thinks about this palpitations.
Yes. Yes.
That's a very common problem.
Yeah.
The good news is most times it's a benign condition and not much to worry about. It can be tricky to diagnose in somebody who has it very intermittently. How often do you have the symptoms?
I have it even like a few minutes ago. I can actually feel my heart kind of like beating a minute, and then it just goes away. And I had all kind of things done. I had stress tests, everything. Yeah. But yeah, I feel like there's got to be something wrong because it's not a natural thing.
So you get it though? Do you get it once a day, once a week, twice a week, once a month?
I get it like a couple of times a week, 2-3 times a week.
Yeah, so that's the fact that you get it frequently. It makes it a little bit easier to diagnose with something like a 30-day event recorder, which may be the next step for you to really pin that down.
All right, because I had a record, a 24-hour record, and it never really said anything.
Yeah, that's the problem with 24 hours is you have to have the symptoms during the 24 hours. There is a loop monitor where you can wear it for 30 days, and that would be much better to try to diagnose your problem.
Oh.
You think, Robert, maybe the excitement of being on this show might have kicked that off? Is that possible?
Pardon me?
The excitement of being on the show might have kicked this thing off.
Probably.
What do you think? I may have to put a warning. I have to put a warning on the show that it may cause palpitations. Yeah. But really, we got to get this checked out. It sounds like it didn't happen in 30 days, but maybe you should wear it again.
Because I would like to really see someone that I could deal with right now. Because I'm really looking. Right now, I'm looking to find a doctor in my neighborhood, because the doctor that I used to deal with, he has gone on to another area, move out the area.
Alan, I think I would, when you find the doctor, just request a 30-day event recorder and an echocardiogram, and I think if those are normal, you should be okay.
I hope so, because, I mean, my father died from a heart attack, and he was 78.
We want to look. We want to make sure that if there's anything there to be found, that we find it. We're happy to help you find a doctor close to you. If you want to come to our hospital, you can. So please give us a call.
What's the number?
It's going to come up on the screen. Okay.
Oh, okay. And you know something else too? I have what they say, I have what you call an athletic heart.
Okay, so he's got an athletic heart. Dr. Heitner?
Pardon me?
I may have to defer to Dr. Salo, who probably has an athletic heart as well over here. But athletic heart, sometimes
I don't even realize that I have a beating in my chest.
Well, Robert, it sounds like we can get this problem worked up. I got to move on, but I think the best advice: call one of the numbers, and we're going to move on. Okay?
Okay. All right.
Thanks a lot, Robert. Hi, Ann.
Yes. Hi.
Hi. Where are you calling from?
Brooklyn.
Which part?
Bay Ridge.
Bay Ridge. Nice, beautiful area out there. A lot of restaurants out there. Tuscany Grill.
Yes, Tuscany. But I have to tell you that I had my reception at Abraciamento's.
Oh, wedding?
Yes.
Yeah, it was.
In 96, but it's been closed for several years now.
I know. It's just in our memories now. And did they do anything with that pier?
No, it's still vacant.
What a beautiful area that was.
It was beautiful, and the restaurant was delicious. But anyway, my question is for the pediatric neurologist.
Okay.
I work with 3, 4, and 5-year-olds. And one of my biggest problems is finding services for that age group, especially for children who have attention deficit hyperactivity disorder, who have behavior problems, and, those kinds of things. Other problems besides, like learning disabilities that usually the schools can address.
Okay, Dr. Nalu, where can we get help for Ann?
Well, I do see all of those problems in my office. I deal with kids with ADHD. I deal with kids with learning disabilities and also autism. So I'll be gladly to help you in any way I can.
So
but what kind of work do you do with these?
I'm a social worker in preschool with the Board of Ed. So, and besides referring children and their families to the Committee on Preschool Special Ed, it's very difficult finding doctors who specialize with such a young age group.
That's true.
You know what? We saw an article in the paper today actually about autism, that mothers 40 years and older have twice the chance of having an autistic child. You see that one, Dr.
Yes,
Noah?
I did see that one. There's a lot of studies on maternal age and kids having learning problems and autism. And
if you're looking at a child, the parents are out there, they're nervous, or the grandparents, is there any one or two things that would say this is something you want to look into, or this could be autism? What might be some of the, you have a 2-year-old, what symptoms might you see?
Well, the main symptom with a lot of autistic kids is the first symptom that parents become aware is that they are withdrawing with their either social skills or eye contact, which is usually what they come to my office for. They're not playing with the other kids, or they're not interacting with other members, not only the family members, but outsiders. So that's what they have.
So that's a worry sign.
Yes.
Anna, thanks for calling.
Okay, thank you.
Take care.
Take care.
We're now going to go. We have an interesting name coming up on line 3, but let's go to Kate first on line 2. Hi, Kate.
Hi, Kate. Yeah, I'm here.
Where are you calling us from, Kate?
I'm calling from Bayside, Queens.
Bayside, great area out there. You ever see the Bay Terrace apartments out there?
Yes, beautiful.
Beautiful. Where do you like to eat out there?
I like Finn's. There's a restaurant there, Finn's.
Finn's.
They make great corned beef sandwiches.
And there's a great delicatessen in the back of the parking lot there. Is that?
Oh, yes.
What is that, Ben's or something? Or?
Yes.
Nice
There's lots of restaurants around Bayside.
Excellent, excellent. What can we do for you tonight?
My daughter was told that her kidneys are only functioning 15%.
15?
Yeah, 15%.
Okay, so she's got some kidney problems, your
yes,
daughter.
she has.
How old is she?
She's 47.
Okay, we don't have the kidney specialist here today, but I'm sure the doctors would take a stab at that one.
All right.
Kidney problems in a 47-year-old.
Yes.
Yeah, there's a kind of a very big differential for that. Does she have hypertension or diabetes?
She has hypertension.
Okay, and is it pretty severe hypertension?
Yes.
Yeah, that's a diagnosis that really requires an extensive workup, and I don't think we'd be able to really. Do you have a specific question about it?
Yeah. How did you know that something was wrong? Was she having pains? Was she having?
Yeah, she was. When she went to the doctor, she wasn't. And she was very, very weak in herself.
Yeah, this is a tough one. This is something that needs to be worked up, as Dr. Heitner said, because there are a number of causes for renal failure, and you want to try and salvage what you can, so you don't want to take a long time. You go to a nephrologist for this. Again, if you want a referral, you can always call us, and we'll give you a referral. We have excellent nephrologists. There are excellent nephrologists in Bayside. So we want to do the most convenient, and then see what we can do to salvage what's left and figure out what the options are.
Yeah.
But it's something that the doctors are able to work a lot better than in the past.
Yeah.
So don't be totally pessimistic about this, but get in there as soon as you can so we can do something. Okay?
Yeah.
And then please call us and let us know. If you need help with the referral, we'll do that. If not, let us know what's going on.
Okay, sir. Thank you very much.
Take care. Let's go to Lauren. Hi, Lauren.
Hi, good night.
Hi, where are you calling us from, Lauren?
Prospect Park, Brooklyn.
Prospect Park. You know that Dr. Saylor can run around the park in 25 minutes?
How would I do mine in 45?
45. Did you ever see?
I'm closer to you than he said, trust me.
Amazing.
Dr. Heitner could probably run it in 22 minutes.
It's amazing. You know that hill is a killer. You know that hill?
With the one by the pond or the one by Grand Army?
Yeah, that pond, the Grand Army.
Yeah?
Yeah, if anybody doesn't know that hill, just go and walk there.
No, and I walk up the hill and I start from there.
That's good. What can we do for you, Lauren?
My question is, I have a 15-year-old that suffers with epilepsy.
Oh.
He suffered with seizures. He had brain surgery September last year, made it 1 year. But he started at 1 year and 5 months. Then he took a 2-year break, and then from then he started having seizures continuously. In September year before when he had the surgery, he had like 30 seizures in 24 hours. That rushed him to have the brain surgery.
Okay, I'm going to ask you to hold on now because we're a little short, and I want to ask Dr. Nalu to talk about recurrent seizures. And he's already done some kind of surgery, which apparently didn't help.
Yeah, he did, but none of the medication that they put him on seems to be helping. He's down that list, you know, that medication, that card that they give you at the hospital where they pick the medications out of. He's pretty much down that list.
Dr. Nalu, what things come to mind here?
Well, so his seizure started at 5 months of age, you said?
1 year and 5 months. That was the first one.
Was there any infection or any trauma at that time? Or
No.
There was nothing. Is there any family history of seizures?
My brother, the one after me, suffered with something like that, but he never ruled his own as seizures.
Okay. And so you said he's currently on a whole bunch of medications, or he's not on?
Yes, he's on Trileptal, Lamictal, Manzel, and...
It's all right. We get the idea. A lot of medications not working. What would be the next step?
Well, surgery is usually the final step when we go to the lot of seizures. And, you know, the goal of the surgery is to cut down the number of seizures. So after the surgery, you said that there is improvement in the quantity?
He did for like 2 weeks. While he was in their recovery, he didn't have any seizures. 2 weeks after that, when he came home, he had 1 seizure at night, and then the following night he had like 9. Okay. But they were pretty mild. Okay. But it escalated from then to now. Pretty much, it constantly keeps changing.
Lauren, it sounds like this is something that we need to get in-depth evaluation. You can get Dr. Nalu's number on the screen, or she'd be happy to refer you maybe to someone if that's not convenient. But I think it's important that we know that it's not working the way it should have, because the surgery should have cut down the seizures. So we got to figure out what's going on. And I really would like you to speak to her in depth after you make an appointment. Okay?
Okay, that'd be great.
Okay, thanks a lot. Take care. Let's go to Joe now. Hi, Joe.
Yeah.
Where are you calling us from?
From Brooklyn.
Which part?
In Bensonhurst.
Bensonhurst, great area. Isn't that Sorrentino? Is Fiorentino's near there?
Yeah.
That's what Anthony likes from Bay Ridge. Yeah.
Right.
What can we do for you?
I got to ask you a question, Doc. I I was out playing golf. I'm going back a few years, but I'm trying to get to a point.
Yeah.
And I got a very rapid heartbeat. And I went through tests and everything. It was decided that they had to put a stent in my heart.
Okay.
So I had the stent put in my heart. And time went by. Then I started to get this rapid heartbeat again. And I would explain it to the heart doctor. And what he did, he said, look, he said, we could either do one or two things. He said, we can do what they call an ablation, where they zap the heart. They have the heartbeat faster, and then where it's beating faster, this is where it was explained to me.
Right. No, it's good. I want to ask Dr. Heitner to touch on this now, because you're discussing an important topic, the idea of a stent and the idea of the conducting system, not necessarily related. So, John, what do you think?
Yeah, but that's what maybe I didn't need this stent.
Well, I'm going to ask Dr. Heitner to give his thoughts on this. What do you think, John?
Yeah, it's fairly unusual for coronary artery disease to present with palpitations. It sounds like you may have had what we call true, and unrelated, meaning you had a blockage in your artery, you have palpitations, but they're probably not related, although it is possible.
Well, the point was when I had gone to and had the ablation, I never got it since. And that's about
good news. Good news.
So it looks like you got both problems fixed then.
Yeah, it's very possible you had both that were unrelated, as Dr. Heitner says. Is you a smoker?
Yeah.
I knew. Dr. Saylor, what do you have to tell him?
Please stop smoking.
What do you? I mean, Joe.
Yeah.
What are you doing here? You getting treated, getting everything better, and you keep smoking.
Yeah, I know. It's a bad situation.
How can you stop?
I try to stop, but it's a little tough.
Joe, I think it's so important. You've really been fortunate. Sounds like you're getting great care. You had a stent, you had an ablation, but you're just asking for more trouble if you smoke. So there are a lot of aids you can use, tools, but really you just have to take stock of your own health and stop smoking. And I think it's critical you do that. Otherwise, you're just looking for trouble.
So you went through all this to get everything fixed.
Yeah.
And it's like pouring gasoline on it now.
Right.
Well,
Joe, you going to call back next week and tell us what kind of smoking cessation you're doing?
How much?
Yeah, tell us next week.
Okay, guy.
Take care.
Thank you.
Be well. Alice,
Yes,
where are you calling us from?
I'm calling from Ocean Parkway in Brooklyn. Ocean
Oh,
Parkway
beautiful
and Kings
area.
Highway.
Ocean Parkway. You ever eat the what is that, Sunshine Cafe on the Kings Highway? What do they call it?
Sunshine Cafe? No.
No, there's a little...
Oh, yes, Sunflower.
Sunflower. That's a nice place. I get
Yeah,
the
the
omelet.
lines are way too long. I like to go to Amazon.
Oh, Amazon. Yeah. The wait is too long. You guys got to go there. Delicious
Oh, I love
omelet.
it. They have the best salad.
See, Alice agrees. Alice, what can we do for you?
What can we do for me? Well, first, shout out to Anthony Falcano at Lexus.
Oh, you know Anthony's got your car too?
I love
This
him.
guy can't fix the car. Oh, he's a great guy. I like him a lot.
Yeah, my lease is up in 2 months, but I'm ready now for a new one.
Which one are you driving?
The GX.
Excellent.
The big truck.
Beautiful,
Love it.
beautiful. Good luck in the snow tomorrow. Okay.
I believe that there's not going to be a big, giant snowstorm.
I agree with you. I think it's hyped, though. Yeah, it's a little hyped. But what can we do for you? You must have a medical issue.
Yes, I do. Sorry.
Yes.
Every time I go to the gym, I've been getting these headaches or lightheadedness. And it's been, in the beginning, it was just like for 5 minutes, 10 minutes when I got off the machine. Now it's lasting all day.
How old are you?
I'm 37.
30. Any medical problems?
No medical problems. Healthy, 2 kids.
Excellent. I'm just going to ask our neurologist and cardiologist and perhaps Dr. Sale. Lightheadedness, are you worried?
Well, it's always after the exercise?
It's during the exercise, and then it stays after.
Okay. Are you going to exercise on an empty stomach or something?
No, I drink a cup of coffee, I have a cereal, and I hydrate.
Okay. So how long does the headache last, usually?
It's been lasting all day.
Okay. And do you feel dizzy? Do you feel any numbness, tingling, any other symptoms with the headaches?
No, just lightheaded, like I'm going to pass out.
Okay. So usually for these kind of headaches, you will want to do a routine physical and including the blood work and making sure the heart is also okay and not becoming hypotensive and things like that.
We need to check that out. John, what do you think?
Yeah, I think the key is it's unlikely that this is heart related. I think it would be a good idea though to get on a treadmill under supervision, have your blood pressure checked at the same time that you're
Probably
doing
before she goes too much longer
That's
on
right.
the treadmill.
That's right.
Good idea to get in and do this. Are you far from? We can help you out. We'll get you a nice setup. So give us a call. We'll get you a referral and make sure that it's nothing serious, and then you can resume.
Okay.
Okay.
Thank you.
Okay. We're going to go to Jamie now. Hi, Jamie. Jaime. It's a different name. Jaime. It was a Jaime. How would you pronounce that?
Jamie.
Jamie. Jamie, I'm on the last call. Okay. We tried. We're going to go now. Hello, who am I talking to, please?
My name is Elena.
Elena, very nice name. I like your voice. It's a nice voice, Elena.
Okay.
Very soothing.
Hey.
What can we do for you?
Yes, I'd like to know, is this Dr. Garner?
Yes, this is he.
Hello. I'd like to know, what paper do you write in? I'd like to read some of your articles.
Oh, thank you. If you go into the tablet, you go to church on Sundays, you're going to find that tablet there.
What tablet?
The tablet is the name of the paper. You can subscribe to it. Tablet, T-A-B-L-E-T.
Okay, and what number do I call to subscribe, please?
If you call the number here, we're going to put it on after the show. And 718-499-6101.
718.
499-6101.
Yes.
And you can read that paper every Sunday, or you can watch on the computer. You can read it.
6101. I do not have, I'm not on the internet, no. I'm hemiplegic from a stroke, so.
You recovering from a stroke?
Hemiplegic. My left side is paralyzed.
Oh. So she had a stroke and is hemiplegic.
Yeah.
Which side are you weak on?
On the left side.
Left side. What preserves his speech? Because she's able to talk so well.
No, my speech is slurred.
No, it sounds very good, you talk. Did you work? Was there rehab?
Yes, I lived in a rehab nursing home for a while, and then I'm getting therapy now. 2 weeks ago, Doc, I had I thought it was another stroke, but the doctor says it's spasming. So I had to go to the emergency. And then they did the MRI and the CT scan and a lot of EKG and a lot of blood tests. And then the doctor said to me, we might have to do the heart catheterization, the thing for the heart. So I said, no, I had it done in Brooklyn Hospital in July. So then he says it's also, they had to fax over the information from Brooklyn to the hospital that I was in. But how often do they have to do this this cath thing for the heart?
Right. How if she's had the cath, how does she?
Yeah, I mean, if you had it 6 months ago, it'd be pretty unlikely you need it again unless you have recurrent symptoms related to your heart.
You mean I would have to have it again?
No, unless you're having recurrent symptoms related to your heart, really probably not necessary.
But you sound great. You really sound great. I'm really happy that you're watching and hope you enjoy the column.
I do, but what I'm curious, I'd like to read an article.
Yeah, you're going to read them. You're going to subscribe. You're going to like the tablet. It's a great paper.
And what number do I call? The 499-6101?
Yeah, call right after the show.
All right, thanks.
Okay, take care. Be well. We're now going to go, hello, how are you?
Yeah, great. I'm a very good friend of Steve Garner.
Do I recognize the voice of Joe Stiles?
Yeah.
I hear that voice. Joe is amazing. Joe, he's on the board of several organizations. He's Knights of the Holy Sepulchre. You have an important title with that group.
Oh, yeah, well, we try hard,
And he's just a great guy. And
Dr. Garner's a great guy, too.
Thank you, Joe. Thank you.
He really is. He's a super guy. He makes an image. He's a role model leader in this field.
Joe, we're running short on time, but keep talking.
All right, God bless
It's okay.
you. I want to say, I hope to see you this coming week.
We're going to go out to lunch this week, all right?
We are.
Okay.
I'll call you.
Thanks a lot, Joe.
God bless you.
God bless you. Hi, Vic.
Hello.
Vic, how are you?
Okay.
What name is Vic? It's an unusual. V-I-C?
No. My name is Claire.
Claire. It's easy to make the mistake. I see it's very similar.
Okay.
Yeah, our guys
I'm
are a little...
inquiring about my grandchild who was recently born.
Yes.
And the parents got this terrible news that he suffers from Willis Prada.
Willie Prada.
W-I-L-L-I.
Yeah.
I never heard of it, but I'd like to turn the TV on and hear what you have to say.
Yeah, and again, what did the baby look like? What tipped him off?
The diagnosis soon after he was born, about 2 months.
Yeah, wasn't thriving? Wasn't...
Oh, too much.
Too much. What do you think about, remember Pray to Willie?
Pray to Willie, it's a genetic disorder. Tell me, how was the baby in the when he was in the hospital, he or she?
As far as I know, okay. It's only when they got him home that they went back for their regular exam and they diagnosed it.
Okay, the baby did have any feeding difficulties?
Yes.
Okay, so a lot of the genetic disorders, including the Prader-Willi syndrome, has what we call hypotonia, or low muscle weakness. So
That's
they have
what they said, yes.
difficulty with feeding. Some of them have difficulty breathing, and they have problems with maintaining the milestones. So that's when the pediatrician or a pediatric neurologist makes the diagnosis, and they are referred to genetic specialists also.
We're really glad, though, to get in to see the right person, to try and understand what the prognosis and how long it's going to go on. But I'm sorry, we have to run now. But if you call back next week, we can resume, okay?
Thank you very much.
Thank you. Good luck. Naomi?
Yes.
Hi, Naomi. How are you? Where are you calling us from?
I am calling from Bay Ridge Parkway, Brooklyn, New York.
Bay Ridge Parkway. What can we do for you?
Well, I would like to ask a question to Dr. Saylor.
Very good. I'm waiting here for a good question. Well, let me hear it.
The question is one of the points that you addressed early on in the program about 9/11.
Yes.
About the fumes and the dust and everything else. But there was also another concern way back in the day about human flesh becoming dust.
Mm-hmm.
And there were also a lot of concerns about respiratory problems and issues that people were going to have on a long-term basis.
Right. They're telling me I got to go, but I want to hear his answer too. Let me hear in 30 seconds.
Hi, Naomi. How are you?
Hi, Dr. Saylor.
Hi. Say hi to Joe for me.
Yes, I will.
Naomi, that's a great question. Again, so many issues with 9/11 we don't know a lot about. Not only human flesh, but all the pulverized steel, the smoke from the plane crash, all of these entities we really don't know a lot about. So I think it's a very nebulous topic. All I can tell you is anyone who has breathing issues who was there that day should seek medical attention. Even though it's a long time away, it's still something you should check with your physician.
Thanks so much. Thanks for the question. We got to move on because I can't believe the show, it just ran away. I don't know what happened, right?
Yes.
You liked it?
Yeah,
That's
definitely.
it. That's it for this edition of the show of Ask the Doctor. I want to thank Dr. Sagarika Nalu, Dr. John Heitner, and Dr. Anthony Saylor for coming in. We hope we were able to help you. It's good to remember you should be proactive about your own health. Speak to your doctors about your concerns. Go for second and third opinions, as we suggested to a lot of the callers tonight. In the meantime, continue to watch NET and visit the website at netny.net/askthedoctor. Here you can check out past quizzes, submit your thoughts on the forum, or watch past episodes. For those who like to tweet, follow us at twitter.com as NET New York, period. I want to thank you all for all your calls tonight. And if you haven't had enough of the show, we'll have last week's show repeated at 10 o'clock tonight on the net. So until next time, goodbye, stay healthy, and I'll see you in the tablet.